You find yourself positioned before your restroom mirror earlier today, observing the identical face under the same illumination during those brief moments preceding your daily routine, when a sudden realization halts your progress. That once defined profile of your jaw has lost its crispness, and the tissue beneath your chin has migrated to a position you never authorized. The edges of your lips curve gently toward the floor, while the depressions beneath your lower eyelids appear noticeably more pronounced than they did 2 seasons prior. You react exactly as most individuals do, by pressing a couple of fingertips against your jawline to pull upward, catching a fleeting 3-second glimpse of your familiar reflection before releasing your grip. You have experimented with various topical formulations, ranging from premium department store brands to basic pharmacy options, and you have researched topics like topical retinoids, protein chains, and manual manipulation techniques. You have dutifully performed the physical routines discovered on the internet, including those awkward movements where you mimic chewing, inflate your mouth, and stretch your chin toward the ceiling, yet your reflection continues its inevitable descent. Allow me to share a truth with you today that is rarely mentioned during a clinical skin evaluation, primarily because there is no billing designation for it and no merchandise to market in tandem with the information. Your features are not dropping simply because your integumentary system is maturing. Rather, this descent is occurring due to structural changes within your vertebral column, particularly within your cervical region. I intend to demonstrate precisely how these two areas correlate, explaining why this relationship is structurally immediate and physically certain, while introducing a single minute-long seated movement requiring no tools to initiate a turnaround. Remain engaged during this anatomical breakdown, because bypassing the science to jump directly to the movement will likely result in a superficial effort and abandonment of the routine within several days. However, once you grasp the actual physiological events occurring beneath your facial and cervical tissues at this very moment, you will commit to this daily practice without exception. If you are visiting this platform for the first time, please subscribe and help us reach our next major milestone as we establish a resource that standard clinical consultations simply lack the opportunity to address. To begin, we must deconstruct a common myth, specifically the typical narrative regarding facial aging, which asserts that structural proteins degrade over time, elastic elements lose their resilience, and gravitational forces pull everything downward. While that explanation holds a degree of accuracy, given that protein synthesis decreases by approximately 1% annually after your third decade and elastic structures lose their snap, it is incomplete. The fundamental anatomical issue with this theory is that it views your features in complete isolation, as though your outer envelope is merely an emptying bladder, or as if gravitational pull acts solely upon the surface layer. This assumption is incorrect, as your features do not resemble an inflatable object, but rather constitute a complex architecture of skeletal framework, lipid chambers, muscular tissue, and a unified fascial network known as the SMAS. This system, formally termed the superficial muscular aponeurotic system, is rarely discussed by beauty consultants, yet it represents the precise layer that medical specialists manipulate during reconstructive aesthetic surgery rather than the overlying dermis. Elevating only the outer layer results in a characteristically taut and artificial appearance, whereas adjusting this deeper fascial plane yields an authentically youthful look by resetting the underlying foundation. A frequently overlooked detail is that this fascial network does not terminate at your jaw, but rather extends downward into your cervical area. It integrates seamlessly with the platysma, a broad, superficial muscular sheet spanning the anterior and lateral aspects of your throat from your clavicle to the edges of your lower jaw. This constitutes a single, uninterrupted tissue plane and a unified structural entity, meaning your head and throat are not distinct anatomy groups but rather a singular biomechanical unit. Consequently, any physical changes impacting your cervical region will inevitably manifest in your facial appearance. No anatomical divider separates these areas, as they exist as one solid system where any downward force applied at the base translates directly to the upper region. Consider your daily habits for a moment, such as reading, browsing mobile devices, performing office tasks, consuming food, and viewing displays. During all of these common routines, your skull inclines slightly forward, not in a severe or painful manner, but merely by a minor angle and a small distance. This position feels entirely natural to you, making it easy to ignore, yet your neck bones feel the constant strain. The cervical region, comprised of 7 distinct vertebral bones, features an inherent natural curve known as lordosis that aligns your skull perfectly above your shoulder girdle. Under this ideal alignment, your skull, carrying a mass of about 10 to 12 pounds, remains perfectly poised so that the supporting musculature performs minimal labor while the weight disperses evenly across spinal discs, articulations, and connective fibers. Shifting that skull forward by a mere single inch increases the functional weight borne by your neck from its baseline up to approximately 27 pounds. This calculation represents a literal physical reality, thoroughly analyzed and recorded in peer-reviewed orthopedic studies concerning spinal biomechanics. Displace it forward by 2 inches, and that constant burden escalates to nearly 40 pounds of force. A 3-inch forward shift, which is highly prevalent among mature individuals after decades of office work or mobile device use, forces your posterior musculature to bear a weight exceeding 60 pounds. When forced to support such a heavy load throughout the day for years, your supporting tissues do not request a break. Instead, they alter their structure by tightening. The rear cervical fibers remain in a state of constant contraction while the anterior throat tissues become overstretched and lose their tone, leading the entire physical column from your occiput to your clavicle to migrate forward. At this juncture, your facial appearance becomes directly involved, and I urge you to observe this sequence of events closely, as it explains the exact reflection you encounter each morning. Once your upper spine sacrifices its proper alignment and your skull migrates forward, 3 specific changes occur in the tissues located above your shoulders. The initial effect is a straightforward physical tension, recalling the platysma muscle that bridges the gap between your collarbones and the edges of your lips. As your cervical posture degrades and your neck column angles forward while your chin drops toward your sternum, this muscle experiences a steady downward stretch that is subtle but persistent over years of daily habit. Because this muscular layer links directly into the deeper facial fascia, it transfers that persistent downward pull directly into the lower region of your face. The sagging areas developing near your jawline do not merely represent aging skin, but rather physical tissue that has been pulled down by a muscle experiencing prolonged, unbalanced tension. Visualize this concept by picturing a heavy stage drape suspended evenly from a straight support beam, looking smooth and perfectly aligned from top to bottom. If an individual grabs the hem of that drape and pulls it firmly toward one side, the material will not necessarily rip, but it will gather, crease, and lose its smooth presentation. The drapery itself did not degrade or wear out. Rather, the supporting beam shifted, and all the suspended material moved along with it. In this analogy, your upper spine serves as that supporting beam, your features represent the drape, and that structural misalignment has been slowly developing for decades. The second primary consequence is the physical pinching of the area located just below your skull. This specific suboccipital zone lies at the absolute bottom of your cranium, right where your head joins your upper cervical spine. This tiny space houses 4 essential muscles, and directly adjacent to them travel the primary upper cervical vessels and key pathways of your fluid clearance network. When an unbalanced forward head alignment pinches this delicate region, which occurs regularly due to the skull shifting backward and downward, 2 vital functions are compromised. The circulation of oxygenated blood to your crown, temples, and facial layers decreases, while the natural removal of metabolic waste from your face becomes restricted. Lymphatic fluid, which serves to clear cellular debris and swelling from your tissues, must pass through specific pathways that run directly through or right alongside this compressed area. When this pathway remains constantly restricted, fluid evacuation slows down, resulting in an accumulation of moisture within your facial layers. You may observe morning swelling that eventually develops into a permanent state of fluid retention as the days progress. Tissues that fail to drain properly over extended periods lose their defined contours, causing your features to appear burdened and weighted down rather than merely relaxed. The third major impact involves your structural connective tissue network directly. Fascia, the fibrous matrix wrapping and stabilizing every element within your anatomy, responds to continuous physical stress by altering its internal alignment. It becomes denser along the lines of constant pull while dropping its supportive tone in areas where it remains persistently loose. When your head projects forward, the connective sheets at the rear of your throat densify and tighten, while the forward layers that link upward to your cheeks stretch out and lose their structural integrity. Loose connective tissue fails to hold your features in place, allowing them to slowly migrate toward your collarbones. To review the sequence of events, a forward-shifted skull compresses the upper cervical space, limits fluid circulation and clearance, exerts continuous downward tension through the platysma and SMS, and causes the supportive matrix of your lower jaw to sag. These combined physical forces drive the downward shift of your features rather than simple aging or genetic factors, and physical forces can be actively adjusted. Let us look at an individual named Dorothy, a 64-year-old former educator who spent 3 decades grading papers and another 10 years looking down at an electronic tablet. This highly organized and proactive woman arrived carrying a folder containing a high-end spa invoice, several informational sheets on protein supplements, and a surgical proposal recommending a minimally invasive facelift. She did not seek assistance due to physical discomfort, as her neck felt fine, and she experienced no head pain, nerve sensations, or notable rigidity. Her visit was prompted by an acquaintance mentioning changes in her physical stance, leaving her wondering if her physical alignment related to what she described as her rapidly aging appearance. The explanation for her concerns was immediately obvious the moment she crossed the threshold. Her auditory canal sat roughly 3 inches forward from the midline of her shoulder, which serves as the classic indicator for evaluating cervical misalignment. Her chin tilted slightly downward, the muscles at the rear of your throat appeared as prominent, rigid columns extending to her upper back, and the front of her throat lacked its typical shape due to the entire structure shifting forward. I instructed her to sit upright and slide her head directly backward without altering her chin level, mimicking a deliberate double chin, which prompted her to laugh and comment on how odd it felt. I requested that she maintain that position for 10 seconds before checking her reflection, which caused her to fall silent for a brief period. She remarked that her defined jawline had suddenly reappeared. While this temporary adjustment did not represent a lasting cure, she recognized the mechanism and understood that her daily reflection was not an unalterable sign of aging, but rather the result of a physical habit formed over decades that could be successfully retrained through regular, targeted exercise. You can easily evaluate your own spinal alignment right this second without any specialized tools in less than half a minute. Simply stand with your spine against a flat vertical surface, ensuring that both your heels and your shoulder blades make firm contact. At this point, determine whether the back of your skull rests easily against the surface, requires a conscious physical push, or fails to touch it entirely. With proper neck alignment, the back of your head contacts the surface effortlessly, keeping the skull balanced over your spine while your chin remains parallel to the ground. If you had to exert significant effort to make contact, it indicates that your natural neck curve has been altered. Should your chin tilt upward during the attempt, or if your skull made contact only by pointing your nose toward the ceiling, this suggests a different mechanical compensation that still requires attention. Keep this physical sensation in mind, as the physical routine we are about to discuss will alter your performance on this test and subsequently transform your reflection. Prior to explaining the exercise steps, let us briefly analyze why conventional solutions fail to resolve this underlying physical cause. Movements aimed at your cheeks, lips, or brow are not without some benefit, but they merely adjust the drape while the underlying support remains crooked. You may train your facial muscles continuously, but as long as the downward mechanical force from your neck persists, any improvements will remain minor. Even high-quality topical preparations only target the superficial skin layers, meaning they cannot reach the SMAS, relax a tight platysma, or decompress the vital area below your skull. This structural issue simply does not begin on the outer surface of your skin. Furthermore, clinical studies regarding ingestible proteins show highly variable results that primarily relate to superficial moisture and texture rather than the physical sagging of deep structural layers. Ultimately, you cannot resolve a structural alignment issue by taking dietary supplements. Continue using these products if you enjoy them, but do not expect them to reposition tissue that is being actively pulled down by a deep structural force beyond their reach. This specific routine consists of 4 structured phases, with each movement serving a distinct anatomical function that must be executed sequentially and without haste. A single sequence requires roughly 1 minute, and you should perform 3 rounds per session twice a day, once after waking and once before bed. In the first phase, sit upright on the forward portion of a chair, with your feet planted firmly and your back unsupported. Without altering the angle of your chin, slide your skull straight backward, as if it were gliding along a flat, level surface. You will feel the tissue at the rear of your neck activate while the muscles at your throat stretch, creating a minor crease under your chin, which indicates proper execution. Maintain this posture for 10 seconds while breathing evenly, Then slowly return to your starting position to complete one cycle. This exercise accomplishes several goals at once, primarily strengthening the deep stabilizing muscles along the front of your neck bones, which typically lose their strength from poor posture. It simultaneously stretches the tight tissue at the base of your head, relieving the pressure on that vital area responsible for fluid clearance and blood flow. This action momentarily resets the proper natural curve of your upper spine, allowing your vertebral discs and joint surfaces to experience correct weight distribution. For the second phase, maintain that pulled back position and picture an imaginary string fixed to the very top of your head, drawing you directly toward the ceiling. Avoid tilting your face upward or raising your shoulders, focusing solely on lengthening your entire spine. This action creates space throughout your neck vertebrae, providing a gentle decompression for each disc and joint over a 5-second hold. This technique utilizes the principles of physical therapy traction, achieved entirely through your own physical control rather than mechanical equipment. This temporary release allows restricted pathways and vessels to open, which directly addresses the fluid retention that causes persistent morning puffiness and facial heaviness when practiced consistently. In the third phase, entwine your fingers and rest your hands right at the base of your head where your neck meets the skull, rather than lower down. Use your hands to apply a very gentle upward lift, as if you are cradling and supporting the weight of your head. From this position, complete 3 tiny and deliberate nodding motions, bringing your chin down slightly and back up over a tiny range of just an inch or two. Rather than exerting force, you are encouraging the tight suboccipital muscles to release, which they do when subjected to light pressure and tiny movements. This release opens the restricted pathways nearby, directly addressing the fluid retention aspect of facial aging. For the final phase, sit with an upward posture and lift your chin by just a tiny margin of 5 degrees. Next, push your tongue firmly against the roof of your mouth and maintain that contact. Perform a deliberate swallow in this position, which will engage all the muscles at the front of your throat from your clavicle up to your jaw. Maintain that active muscle contraction for 5 seconds after swallowing before relaxing fully. This is a highly functional movement that trains your platysma and surrounding throat muscles to contract in an upward direction. This action counters the downward stretch these tissues have endured due to poor posture. With regular practice, the baseline tension of these tissues improves, reducing the constant downward pull on your facial fascia. Within just a few days of twice-daily practice, you will find the spinal assessment much easier to complete, sometimes after only one try. Do not mistake this quick improvement for a permanent structural correction, as it simply represents your muscles releasing their initial tightness. After a couple of weeks, the improved circulation will begin to reduce morning swelling, making your features look more defined and rested. By the second month, your deep supporting muscles will gain real strength, allowing your neck to regain its proper curve while reducing the downward pull on your lower face to the point where others begin to notice the change. Lasting structural corrections to patterns built over decades require several months to fully establish, but your body will steadily adapt to this positive physical input starting from the very first weeks. In between your daily sessions, maintaining a conscious awareness of your alignment serves as your ongoing structural maintenance. When using your mobile device, raise the screen toward your eyes instead of bending your neck downward. Similarly, when dining, bring your food up to your mouth rather than leaning your head down to the plate. These simple modifications prevent you from constantly counteracting the benefits of your daily exercises. If you experience any sensory changes, numbness, or weakness radiating into your upper extremities during these movements, pause immediately and consult a healthcare professional. Such sensations can signal spinal nerve irritation that requires proper medical evaluation before you continue. Anyone diagnosed with spinal canal narrowing should discuss these exercises with their physician before starting. Likewise, individuals with a history of neck surgery, joint fusions, or herniated discs may require specific modifications based on their medical history. Ensure that an expert familiar with your health background reviews these physical movements. For the majority of healthy individuals, these gentle actions are entirely safe and easy to perform, though taking a moment to confirm safety is always wise. Here is your simple action plan for the next 12 hours. First, perform the spinal alignment check against a wall today. Note your initial position and capture a side view photo of your head and neck to establish your starting point. Second, complete one full round of all 4 exercises tonight, moving deliberately to ensure you gain the full physical benefits. Third, when you first check your mobile screen tomorrow, consciously lift it to eye level to observe how this simple adjustment improves your neck alignment. Fourth, reassess your alignment against the wall in 2 weeks and compare your progress with your initial baseline photo. Finally, remain patient with this process, as reversing years of structural habit takes time, but consistent daily effort will yield visible, lasting results. Before you leave, I would love to know your age range and your current location. Please share both details in the comments section below, as this information helps tailor our future anatomical discussions to your specific needs. The postural and fascial changes we discussed today impact everyone differently based on their history, career habits, and age-related hormonal shifts. If most viewers fall into their 60s and 70s, our next discussion will focus on how mature hormonal changes affect structural tissue strength and how to address it. If many of you are in your 50s, we will dedicate an episode to fluid clearance, as this age group often experiences highly rapid improvements from targeted drainage. Your demographic details and location truly help shape the direction of this channel. Lastly, if you know a loved one who continues to invest in expensive skincare with minimal results, please share this structural approach with them. The solution was never found in a jar, but rather in the underlying skeletal and muscular framework, which always adapts beautifully to correct, consistent physical input.